What's up, everybody? Welcome back. Today we are going to go through a video that just explains what's going on with your neck. If you're having any neck issues, big goal is you got to figure out what is causing your neck pain, and then you can go after how to fix it. There are three big major common issues that occur in the neck, three common structures that get irritated. There are the muscles. Muscle strain, get a little whiplash, anything like that. That is going to cause a muscle strain. That's going to tug on those muscles and cause them to tighten up, tighten down. That causes one set of issues. Other thing that can happen is the joints. The joints can tighten up as well. That can cause typically a lot of movement restriction, especially with rotation, extension. Those are going to be those big ones that are going to limit your overall movement. But muscles can definitely limit those as well. So we're going to talk about how to kind of differentiate whether it is a little bit more muscle or a little bit more joint. Both of those tend to kind of go together. If you think about you have a little bit of a trauma, maybe you have some whiplash or something like that, you're going to probably jam those joints as well. It's kind of like jamming your finger. Everything's going to get nice and inflamed. It's going to be hard to move, but those muscles are also going to accommodate, and they are going to tighten up as well. So you really need to work on a little bit of both, but you need to figure out which one of those is the primary issue so you can focus on that one and go after that one the most. The other big thing that can happen is going to be a nerve issue. There's a lot of other reasons for the nerve issue, whether you have a disc herniation, you have some nerve root impingement, have some inflammation right around where that nerve root exits, or you can have some stenosis. There are definitely a couple other things that can cause that, thoracic outlet, lots of other issues, but we're going to kind of lump all those together in a nerve bundle, and you can go into a deep dive on those later on how we kind of treat those. We definitely have some more videos on how to address those nerves, but taking it easy, starting off, we're just going to nice and easy again try and figure out what is causing it. Nerve is probably one of the easiest ones to see if that is the primary cause. If you have numbness tingling down the arm, the nerve is being affected, we need to address the nerve first. That is going to be the primary thing that we address. But to address that nerve, we're going to need to calm down the muscles, we're going to need to calm down the joint. So the treatment goes along with kind of both of those nerve and joint treatments that we're going to do. But you need to add in a little bit of some nerve gliding or something like that to decrease nerve path, little soft tissue at some of those common impingement symptoms and areas that commonly occur where the nerve kind of gets pushed on through there. But going back into joint, easiest way to figure out the joint, if you look at the neck, we have little joints, they're called our facet joints. They need to slide on each other. We have them on both sides. When you look up, they kind of slide down. When we look down, they slide up. If we go to the left or to the right, they kind of slide up and down. One side slides down, one side slides up. So if you have problems looking up, have problems looking to the left, that pain is on the left, that is a joint issue. That is a facet joint closing issue. So now we need to go in and we need to work on those little joints where you have the pain to try and help improve that rotation. We will throw some videos down below that will give you a better idea on how to do that and those areas that you need to work on in order to improve those joint mobility issues. From there, if we have a lot of problems looking down, we feel that tightness all the way through the back, we feel that restriction going up the back. If we look to the right and we feel a nice big pull on the left or we have pain on the left, that is typically going to be a muscle issue. That's going to tell me that the muscle is the primary thing that is causing everything. So now we need to do soft tissue work to the muscle. We need to get that muscle loosened up. Again, you might have symptoms a little bit of both where you have, it hurts on the left, hurts on the left, hurts on the left. Okay, now we have muscle and joint issue on the left. We need to work on both of those to try and get all of that loosened up. That's just kind of a quick explanation on what you need to work on if you're having neck pain, neck limitations, neck issues. I know it can be a pain in the neck. So having a little bit of clarity on figuring out exactly what's causing it can help you fix it. That's the goal of this video, is to try and hopefully give you a little bit of insight on where to start and what to kind of focus on. If you like this video, make sure you like and subscribe to our YouTube channel so we can keep bringing you videos to keep you living an active and healthy life.